Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary anatomy and histology. Question number first. The artery which arises from the subscapular artery is options A. Suprascapular artery, options B. External thoracic artery, option C. Posterior circumflex artery, or options D. Radial artery. The right answer is option C, that is a posterior circumflex artery. The artery which is arises from subscapular artery, that is a posterior circumflex artery, and thoracodorsal artery. The posterior circumflex artery also has two branches. That's the upper branch, which is supplied blood to the deltoid, triceps, brachialis, teres minor muscles, while there's a lower branch which gives a nutrient artery to that humerus. And there's a thoracodorsal artery which is mainly supply blood to the teres majors and subscapular muscles. Okay, we all know that the subscapular arteries arises from that the axillary or subclavian artery. The subclavian artery is that directly arises from the arc of the aorta, or that it arises from that brachiocephalic trunks. Okay, the left subclavian arteries arises directly from that arc of the aorta, while that right subclavian arteries arises from that the brachiocephalic trunks. And this both artery give off that falling intrathoracic branches at their thoracic courses, and they leave the thoracic cavity as extra thoracic part. Okay, in the intrathoracic part, it mainly consists of costocervical artery, and there's a superficial or inferior cervical artery or internal thoracic artery. The costocervical artery, which includes that dorsal artery, intercostal artery, deep cervical artery, and vertebral artery. Okay, and after that leaving that after the leaving the thoracic cavity, that extra thoracic part, it mainly consists extrathoracic artery or suprascapular artery, subscapular artery, which mainly includes thoracodorsal and posterior circumflex artery. And there's an anterior circumflex humeral artery, deep brachial artery, which mainly includes collateral ulnar artery, and there's a transverse cubital artery. And after giving that common interosseous artery, that it is continue as a median artery, which end as radial and ulnar artery. Question number second. The artery which passes through the carpal canal is options A, ulnar, options B, median, option C, radial, options D, common interosseous. The right answer is option A, that is the ulnar artery. Okay, the ulnar artery actually passes through the carpal canal. Okay, ulnar artery is the main continuations of the median artery. It is descend down under flexor carpi radialis muscles, passes through that carpal canal, and it's continue further down metacarpal regions, and ultimately gives volar common digital artery, which gives two volar proper digital arteries. Okay, and we all know that's the median artery, which is the distal continuation of that deep brachial artery after it detaches the interosseous artery, and it is passed downward along the posteromedial aspect of the radius along with median nerve, and it divide into that radial and ulnar artery. Okay, this radial artery goes along posteromedial aspect of the radius and reaches the posterior surface of the carpus, and is continue as a volar medial metacarpal artery. Okay, while this common interosseous artery is a large vessels, which is actually detached from that deep brachial artery at level of a proximal interosseous space. It's give off branches to the proximal end of flexure muscles, passes through proximal interosseous space, and continue as an anterior interosseous artery along the group between that radius and ulna. Questions number 3. The middle meningeal artery is branch of options A, common carotid, options B, occipital, option C, internal carotid, options D, external carotid. The right answer is option C, that is the internal carotid. Okay, middle meningeal artery is a branch of internal carotid artery. Okay, if we see that's common carotid artery, which is arises from that the direct from the arc of the aorta, it has two, there's a left and right artery, and it gives internal and external carotid artery along with that collateral branches. The collateral branches of that common carotid artery, that's a tracheal, esophageal, muscular, caudal and cranial, thyroids, laryngeals and pharyngeals. And if we see that's the form, if we see that is the mnemonics, then we can learn it's like LP med CT2, where L stand for laryngeals, P stands for pharyngeals, M stand for muscular, E stand for E stand for esophagals, T stand for tracheal, and CT, that is stand for caudal thyroids and cranial thyroids. Okay, and since it's give two branches, that's the internal carotid artery and external carotid artery. Okay, this internal carotid arteries gives main branches as like occipital arteries, which gives the following sub branches, that's the palatine artery, stylomastoids artery, middle meningeals artery, caudal meningeals branch, and condyloids artery. We can learn as PSC CMM, where P stand for palatine, S stand for stylomastoids, C stand for caudal meningeals branch, and another C stands for condyloids artery, M stand for middle meningeals artery. Okay, and we see that's external carotid artery, which is also arises from common carotid artery, give off falling branches on way and continue as a maxillary artery. The branches of external carotid arteries includes lingofacial artery, which include linguals and facial arteries, and there's a caudal auricular arteries, and there's a mesenteric arteries, superficial temporal arteries, which mainly includes transverse facial artery, cranial auricular arteries, palpebral arteries. We can learn as the branches of external arteries as LCMS, where L stand for lingofacials, C stand for caudal auricular artery, M stand for mesenteric, and S stand for superficial temporal artery. Okay, since that external carotid artery, after that giving of the branches on the way, is continue as a maxillary artery. Okay, maxillary artery is that external carotid artery which continue as maxillary artery, and after giving superficial temporal artery, giving of falling branches on its course and ultimately and terminal branches, that's descending palatine artery and infraorbital artery. If we see that branches of that maxillary artery, it's mainly includes mandibulo-alveolar artery, pterygoids artery, deep temporal artery, buccal artery, ophthalmic artery, and malar artery. We can learn by the mnemonics, that is MPDBOM, where M stand for mandibulo-alveolar artery, P stand for pterygoids artery, D stand for deep temporal artery, and B stand for buccal artery, O stand for ophthalmic artery, and M stand for malar artery. There is a note that a supraorbital artery is also a branch of external ophthalmic artery. Okay. Questions number 4. Right gastric artery in ruminant is given by options A, hepatic artery, options B, right ruminal, option C, that's left ruminal, options D, abomasals. The right answer is option A, that's a hepatic. Okay. Right gastric artery in ruminant is given by actually that's hepatic artery. Okay. If we see that's the abdominal aorta, the aorta which that extend from the hiatus aorticus, which is present in diaphragm, and terminate below fifth to sixth lumbar vertebra. It's actually divided into two external and internal iliac artery after that end. Okay, and if we see that's branches of abdominal aorta, it's mainly includes celiac artery and cranial mesenteric arteries, and there's a renal arteries, testiculars or ovarian arteries, and last, there's a median sacral artery, which is a continuations of this abdominal aorta after the detachment of this external and internal iliac artery. Okay, this celiac artery is the celiac artery is that largest branch of that the abdominal aorta. And if we see that branches of the celiac arteries mainly includes splenic artery, right ruminal artery, hepatic artery further give branches, that is a pancreatic artery, cystic artery, right hepatic, gastroduodenal, which also have two branches, that's a pancreatic duodenal and right gastric epiploic. And there's a left hepatic artery which gives right gastric artery, and there is a abomasals, which further gives a left gastric and left gastroepiploic artery, and there's a left ruminal and phrenic artery. Okay. Questions number 5. Posterior uterine artery is arises from options A, abdominal aorta, options B, internal iliac artery, option C, external iliac artery, options D, internal pudendal artery. The right answer is options D, that is internal pudendal artery. Okay. The posterior uterine artery is actually arises from that internal pudendal artery, that we all know that abdominal aorta is end into that the internal iliac artery and that external iliac artery. This internal iliac artery actually supply the blood to that pelvic viscera and pelvic wall, while that external iliac artery supply blood to the hind limbs. Okay, and hind limbs, and it is mainly originated from that continuation of abdominal aorta below fifth or sixth lumbar vertebra. It skips branches and finally terminate by dividing into caudal gluteal and internal pudendal artery. Okay. If we see that branches of this internal iliac artery, then we found there is a umbilical artery. Umbilical artery, which mainly includes that ureteric branch, which supply blood to that ureter, vesicular part, which supply blood to the cranial part of the bladder, and there is a uterine branch, which mainly supply blood to the uterus. That's middle uterine artery. It's mainly supplied to the horn and body of the uterus in female. While in case of a male, there is a differentials branch, which mainly supply to the ductus deferens in male. Okay. Second is that's iliomuscular artery, which supply to that iliacus and zoes majors muscles. And then there's a cranial and caudal gluteus artery, which supply to the muscles of hips. And we can see there's a urogenital artery. In male, its branches supply to that bladder, vasa deferens, seminal vesicles, and pelvic part of urethra. While in female, its branches mainly supply to the uterus. That's a caudal uterine artery, bladder and urethra and vestibules. Obturator artery, which supply to that obturator internus and externus muscles. Okay. And last is that internal pudendal artery, which is a terminal branch of internal iliac artery. It's give branches to that muscles of a perineum, rectum, obturator, externus, bulb of penis in male, while in female it's give posterior uterine artery, and give muscles and rectal branches to the vagina, vestibules, and vulva extra. Okay. We have to remember that the posterior uterine artery is actually arises from internal pudendal artery, and that caudal uterine artery is arises from urogenital artery. And if we see that the middle uterine artery is arises from that umbilical artery. Okay. Questions number 6. The saphenous artery, which supply posterior aspect of hind limbs, is replaced by artery in horse is options A, posterior femoral, options B, posterior tibial, option C, anterior tibial, options D, popliteal. The right answer is options B, that is a posterior tibial. Okay. The saphenous artery, which supply a posterior aspect of the hind limbs, is replaced by posterior tibial artery in case of horse, which is applied to posterior aspect of the hind limbs in horse. Okay. Since we know that external iliac artery, which is supply blood to that hind limbs. Okay. These are the large vessels, which is arises from that abdominal aorta below fifth or sixth lumbar vertebra. It give off falling branches, and finally it is continue as a popliteal artery below stifle joints. Okay. If we see that branches of external iliac artery, it includes deep circumflex iliac artery and deep femoral artery, lateral circumflex femoral artery, saphenous artery, genicular artery, and there's a caudal femoral artery. Okay. Deep circumflex iliac artery mainly supply to abdominal muscles, tensor fascial lata, and craniolateral part of quadriceps femoral muscles. While if we see the deep femoral artery, it mainly gives a pudendo-epigastric artery, which is mainly supplied to scrotum's pubis in male, while mammary artery, which supply to the mammary gland in female, and medial circumflex femoral artery, which supply medial and posterior aspect of thigh. Lateral circumflex femoral artery supply quadriceps femoris muscles. Okay. Saphenous artery supply to the posterior aspect of the hind limbs. Genicular artery arises at distal third of the thigh and supply to the sartorius, semimembranous, and distal part of the quadriceps femoris muscles. And if we say that caudal femoral artery, it's originate from that femoral artery just above the stifle joint, is supplied to that adductor, vastus intermediatus, gastrocnemius, and superficial digital flexors muscles. Questions number 7. The superficial lymph node presence in the head regions of cattle is options A, pterygoids, options B, parotid, option C, atlantal, options D, prescapular. The right answer is options B, that is a parotoid. Okay. Parotoids, the superficial lymph nodes are those lymph nodes which can be easily palpated by that externally with the help of hand. Okay, now. And if we see that superficial lymph node presence in cattle, that's mainly includes mammary lymph nodes, which is 2 in numbers and quite large in size, located dorsally on that to the udder. Okay. Second is subiliac prefemoral lymph nodes, which is founded in between tuber cocci and stifle joints. Okay. And there is a prescapular lymph node, which is found somewhere cranial to the muscles of that soldiers. Okay. And there's a parotid and mandibular lymph node, which is mainly located in head regions. Parotid lymph node lie to rostral part of that parotid salivary glands, ventral to that ears. Okay, while mandibular lymph nodes lie that's ventral part of the mandible. Questions number 8. Popliteal lymph nodes is superficial in case of options A, cow, options B, buffalo, option C, dog, options D, donkey. The right answer is option C, that is a dog. Okay. Superficial lymph nodes, which is mainly presence in dog, mainly includes there's a prescapular lymph nodes, which is located cranial to the scapula. Axillary lymph nodes at the junction of that forearms along the brachioplexus on medial side of the arm. There is a axillary lymph node, which is not palpable in normal conditions, but only seen in case of diseased dog. Okay. Popliteal lymph nodes, which is palpable in both dog and cat, lie caudal side of the stifle joints. Okay. Scrotal or superficial inguinal, which is just lie cranial to that spermatic cord in case of male, while in female in groin area in either side of the linea alba. This is superficial inguinal lymph node. Okay. Submandibular lymph nodes, which is lie on the ventral side of the mandible. Questions number 9. Cytogenous gland is options A, parathyroid, options B, ovary, option C, adrenal, options D, thyroids. The right answer is options B, that is the ovary. Okay. Cytogenous glands are those glands which secretion is, that is a cell, that's a living cells, which secretes living cells as their secretions. For example, ovary, which secretes ovum as their secretions, and testis secretes that sperm or spermatozoa as their secretion. Okay. Questions number 10. Mucosa of the ureter is lined by options A, simple squamous epithelium, options B, simple cuboidal epithelium, option C, transitional epithelium, options D, pseudostratified epithelium. The right answer is option C, that's a transitional epithelium. Okay. Mucosa of the ureter is actually lined by transitional epithelium. Let's see some type and location of the epithelial tissue. Then we found that the simple squamous epithelium, which is also known as pavement epitheliums. It is mainly found at the terminal bronchioles and alveoli of the lungs, and also that wall of the Bowman capsules and loop of Henle, and also in it lined membranous labyrinth, that is internal ear, and it's lined blood vessels, lymph vessels, and heart, and coelomic cavity and reti testis of testis. Okay. Second is simple cuboidal epitheliums, which mainly line salivary and pancreatic duct, ovary and seminiferous tubules. Okay. And we see that's third, that's a simple columnar epitheliums, which mainly lie that stomach and that intestine, gallbladder and bile duct, gastric glands, intestinal glands, and pancreatic lobules. Okay. There's a ciliated epitheliums, which are two types. That's a columnar ciliated epitheliums and there's a cuboidal ciliated epitheliums. Columnar ciliated epitheliums mainly line fallopian tubes, while cuboidal ciliated epitheliums mainly line nephron of kidney. Okay. Pseudostratified mainly found in trachea. Okay. Keratinized stratified squamous epitheliums, which mainly presents in that is hair, nail, hoof, skin, extra. Non-keratinized stratified squamous epitheliums, which line mainly oral cavity, and there's a buccal cavity, and there's a pharynx, esophagus, and it also lies at the lower part, that's a vagina and the cervix. Okay. Stratified cuboidal, which mainly lines sweat glands, duct, salivary and pancreatic duct. Okay. Stratified columnar, which line that larynx and upper part of the soft palate. Okay. While transitional epitheliums, which has the property of elasticity, it's mainly found in that the urinary bladder, ureter, renal pelvis, upper part of the urethra, extra. Okay. Questions number 11. The cytoskeleton of the cells is options A, microfilament, options B, mitochondria, option C, lysosome, options D, Golgi body. The right answer is option A, that's a microfilament. Okay. A cytoskeleton of cell is microfilament. That a network of a protein, which is a filament, which is extending throughout the cytoplasms of the cells, which is known as the cytoskeletons. Cytoskeletons are actually of three types, that's microtubules, microfilaments, and intermediate filaments. Okay. Microtubules is the largest cytoskeleton filaments. It's mainly composed of a protein tubulin, and it also contain 10 to 15% microtubules, associated protein, and also tau proteins. Its main function is that maintain of the shell shape. Okay. Second is microfilaments, which mainly consist of that actin protein, is a fundamental role in muscles contractions and is association with many other proteins that organize and cross-link microfilament. It also involved in cell divisions, endocytosis, exocytosis, cell locomotions, and maintenance of shell shape. And third is intermediate filaments, which is mainly composed of different types of protein like keratin, bimentin, desmin. Major function is not understood, but probably to give mechanical strength and stability. Okay. And there is a note that mitochondria, which is also known as powerhouse of cells, play major roles in ATP productions. Okay. Lysosomes, which is known as suicidal bag, which contain hydrolysis enzymes that hydrolyze dead and unwanted intracellular constituents, and the Golgi bodies, which is responsible for post-translational modifications of protein. Questions number 12. The nucleus is a cartwheel shape in options A, lymphocyte, options B, plasma cells, option C, mast cells, options D, monocytes. The right answer is options B, that's a plasma cells. Okay. The nucleus of plasma cells is cartwheel in shape. Okay. Let's see the different types of WBC along with their shape of the nucleus. Then if we see that's acidophils or eosinophils, their nucleus is bilobed in shape. Basophils, their nucleus is ash in shape. Okay. Neutrophils, their nucleus is multi-lobed. Okay. Monocytes nucleus is a kidney shaped. Okay. Lymphocytes nucleus is rounded. Okay. There's a note that's parietal cells, which is mainly found in that stomach, responsible for the secretions of that acids, is are binucleated. Okay. Questions number 13. The inclusion body seen in cell is options A, lysosome, options B, peroxisome, option C, lipofuscins, options D, ribosomes. The right answer is option C, that's the lipofuscins. Okay. Uh, Lipofuscin is a fine yellow brown pigment granules, which is mainly composed of lipid containing residue of lysosomal digestions, mainly found in liver, kidney, heart, muscles, retina, adrenal gland, nerve cells, and ganglion cells. It's also known as aging pigment, as thus age cells contain more lipofuscins, and it also considered as wear and tear pigment. Questions number 14. Loose connective tissue consists of cells in which most numerous cells is options A, fat cells, options B, plasma cells, option C, histiocytes, options D, eosinophil. The right answer is option C, that's the histiocytes. Okay. Loose connective tissue, which mainly consists of cells in which most numerous cells is histiocytes. It's a type of immune cells in connective tissue. If we say that's most abundant tissue in the body, that's among all tissue, that's a connective tissue, most abundant tissue in the body. And the common cells which is found in connective tissue, that's a fibroblast, fibrocytes, which is responsible for the synthesis of fibers, macrophages, plasma cells, mast cells, and adipocytes. While fiber, which is present in connective tissue, mainly includes collagen fibers, elastic fibers, and reticular fibers. Okay. Let's see the different types of connective tissue. The connective tissue is first divided into two types. There's a proper connective tissue and there's a specialized connective tissue. The proper connective tissue is also further divided into two types. There's a loose connective tissue and there's a dense connective tissue. While specialized connective tissue includes that bone, cartilage, and bloods and lymph. Okay. Loose connective tissue includes areolar, which is a subcut, which is present in a subcut layer of the skin. Adipose, which store fat, and there's a reticular, which forms supporting network of liver, spleen, and lymph node, mainly found in that immune organs. Okay. While dense connective tissue includes, it's also two types, it also three types. That's a regular dense connective tissue, and irregular dense connective tissue, and elastic tissue. Regular dense connective tissue, where the bundle of the collagen fibers arranged parallelly, and that fibroblasts are arranged in between them. Okay. And it is found mainly in tendon and ligament. While irregular dense connective tissue mainly presents in dermis of skin, pericardium, and periosteums. Elastic tissue, that's yellowish color due to elastin proteins, mainly found in lungs tissue. Okay. If we see that specialized connective tissue, which mainly includes cartilage, there's a cartilage, that's a hyaline cartilage, which mainly found in the end of the long bone, and intercostal muscles in between the ribs. And there's a fibrocartilage, which is strongest one, found in intervertebral dishes. Elastic cartilage, which is mainly found in epiglottis, stitch tubes, and external ear. Questions number 15. The perinucleus halos are seen in options A, skeletal muscles, options B, smooth muscles, option C, cardiac muscles, or option D, liver cells. The right answer is option C, that's the cardiac muscles. Okay. The perinuclear halos, which is a morphological finding referring to the presence of a vacuolated area that surround the nucleus, results from nucleus shrinkage, are mainly seen in cardiac muscles. Okay. Let's see the different types of skeletals, smooth and cardiac muscles. Skeletal muscles, also known as striated muscles, or smooth muscles, that's the non-striated muscles, and there's a cardiac muscles. Striated muscles is mainly found in those organs, that's a voluntary organs, that's the limbs, face and neck regions. Non-striated muscles mainly found in viscerous organs, while cardiac muscles found in wall of heart. Striated muscles are cylindrical in shape. Non-striated muscles are spindle in shape, and also cardiac muscles also cylindrical in shape. If we see that striated muscles, it is multinucleated. Non-striated muscles are uninucleated. Cardiac muscles also uninucleated. Okay. Location of a nucleus in striated muscles is peripheral. Nucleus is located at central position in case of non-striated. Nucleus is in center in case of cardiac muscles too. Okay. Myofibrils show alternate dark and light band in case of striated muscles. Myofibrils are without light and dark band in case of non-striated muscles, and myofibrils show faint light and dark band in case of cardiac muscles. Okay. If we see that fibers are unbranched in case of striated and non-striated muscles, while fibers are branched in case of cardiac muscles. Intercalated discs are absent in case of striated and non-striated muscles, while intercalated discs are present in cardiac muscles. And if we see that's nature of the muscles, which is voluntary in case of striated, while involuntary in case of non-striated and cardiac muscles. Questions number 16. The neuroglial cells is options A, microglial, options B, mast cells, option C, plasma cells, options D, neurolemmacytes. The right answer is options A, which is a microglial cells. Okay, glial cells are the cells which are non-neuronal and are located within a CNS and PNS. That provide physical and metabolic support to the neuron, mainly includes neuronal insulations and communications and nutrients and waste transports. These glial cells are mainly divided into four major groups, that is microglial cells, astrocyte cells, oligodendrocyte cells, and their progenitors, Ng2 glials. These are the type of the glial cells. Okay. Questions number 17. Pair patches are present in options A, stomach, options B, small intestine, option C, large intestine, options D, tongue. The right answer is options B, that's a small intestine. Pair patches are actually the nodules of lymphatic cells that aggregate to form bundle or patches, and it mainly occurs in the lowest portions of that small intestine, that is mainly in ileum, and it is responsible in defense mechanisms. Okay. Questions number 18. The Brunner glands in the duodenums are present in options A, mucous membrane, options B, submucosal layer, option C, tunica muscularis, options D, tunica serosa. The right answer is options B, that's a submucosal layer. Okay. The Brunner gland in the duodenums are present in the submucosa of the duodenums. It's mainly secretes an alkaline fluids which contain mucin, which protect the mucosa from that acidic stomach content and entering the duodenums. This Brunner glands also secretes hormones released into that blood streams by duodenums. It stimulates that secretions by livers and pancreas. Okay. Questions number 19. Canal of hearing are observing options A, kidney, options B, liver, option C, spleen, options D, brain. The right answer is options B, that is a liver. Okay. Canal of hearing are actually observed in a liver. This canal of hearing is begin in that lobules, is actually lined by partially by the cholangiocytes, that's the gallbladder cells, and partly by hepatocyte cells. It mainly conduct bile from that bile canaliculi to terminal bile duct and portal tract. It's not readily apparent on routine histological staining, but are highlighted by biliary cytokeratin, that is CK19 and CK7. Questions number 20. M zone is seen in the options A, spleen, options B, thymus, option C, adrenal gland, options D, pituitary gland. The right answer is options A, that is a spleen. M zone is actually known as marginal zone, is the regions which is located at the interface of the non-lymphoids red pulps and the that's lymphoids white pulps of the spleen. Okay. Questions number 21. The pineal gland is present in options A, telencephalon, options B, myelencephalon, option C, diencephalon, options D, mesencephalons. The right answer is options C, that is diencephalon. Okay. The pineal gland is present in diencephalons. It is actually a small P-shaped gland which is located in the brain, produce a hormone, that is melatonin hormone, which is responsible for regulating a sleep pattern, that is circadian rhythms. Okay. Let's see the different part of the brain. We found there's a diencephalon, which mainly includes which is the central portion of the brain located around the third ventricles, superior to the brainstem, that is a medulla, pons, and midbrains, and inferior to the corpus callosum and cerebral cortex. It is mainly divided into major four-part diencephalon, that is epithalamus, thalamus, subthalamus, and hypothalamus. Okay. Telencephalons, which is in brain, includes cerebral hemispheres, cerebral cortex, subcortical white matter, basal ganglia, basal forebrain nuclei, and other many structures lying below this, including corpus callosums. Okay, mesencephalons, which is that brain stems and midbrain. Okay, metencephalons, which mainly includes pons and cerebellums. Okay, myelencephalons, which mainly includes medulla. Okay, there's a note that forebrain mainly includes diencephalons and telencephalons, midbrains, that is mesencephalons, hindbrains, that's metencephalons and myelencephalons. Okay. Questions number 22. The space between the duramaters and arachnoid is called options A, epidural space, options B, subdural space, option C, subarachnoid space, options D, cisterna magna. The right answer is options B, that's a subdural space. Okay. The brain and spinal cords are actually enclosed by the membranous covering, that is for their protection, that is known as meninges. The meninges are of three types, that's the duramaters, arachnoids, and pia matters. From that outside to insides, the space between that spinal columns and the dura mater, that is known as epidural space, which is filled with areolar and adipose tissue. The space between dura maters and there's arachnoid, that is known as subdural space, which is mainly filled with a small amount of fluids. And the space between arachnoids and that pia matters, that's known as subarachnoid space, which is mainly filled with CSF fluids, that's cerebrospinal fluids. Okay. Note that's a cisterna magna, which is a space between the inferior margin of the vermis. Vermis is that unpaired median portions of the cerebellum that connect two hemisphere, and the posterior rim of the foramen magnum. Okay. Questions number 23. The dorsal part of the midbrain is options A, tegmentum, options B, tectum, option C, pituitary gland, options D, cerebral peduncle. The right answer is option B, that is a tectum. Okay. The dorsal part of the midbrain is tectum, while the ventral part of the midbrain, that's a floor of the midbrain, that's tegmentum. Okay. Midbrain mainly comprise that's a cerebral aqueduct, corpora quadrigemina, and that crura cerebri. Okay. Cerebri aqueduct is a narrow passage through the mesencephalon and connect the third and fourth ventricles. It's mainly lined by ciliated columnar epitheliums and it's mainly surrounded by the gray matter. Okay. Corpora quadrigemina. These are the two pair rounded body which is located on dorsal aspect of the midbrain, also called superior nates and inferior colliculi testis. The pinal body is situated in the space between the anterior part of the superior colliculi. Okay. And crura cerebri, which is known as cerebral peduncle, two broad bundle at the ventral surface of the midbrain. Okay. Questions number 24. The floor of the lateral ventricle is form of options A, fornix, options B, hippocampus, option C, corpus callosum, options D, caudate nucleus. The right answer is options A, that's a fornix. Okay. Uh, Okay, the floor of the lateral ventricle is mainly formed by the fornix, while the roof of the lateral ventricle is mainly formed by corpus callosum. Okay, if you see that's ventricles, ventricle is nothing. These are the fluids filled. Actually, CSF, that's cerebrospinal fluids fills spaces, cavities within a brain. This CSF is mainly produced by choroid plexus, which is epithelial cells lining ventricles. Okay, if we see there's ventricles, there are four types of ventricles found within a brain. There's a lateral ventricles, which is left and right. Okay, these are largest ventricles, and both are she-shaped, one body, and there is a three horn projecting into the brain, namely anterior horn, posterior horn, and inferior horn. Okay, body, that's the central part of the lateral ventricles, which is located in the parietal lobe below the corpus callosums, which communicate with the third ventricle through interventricular foramen, that's the foramen of Monro. Okay. Third ventricles, that is which is located in the midline, narrow space between the left and right diencephalon, connected with the fourth ventricle through that cerebral aqueduct, that is known as mesencephalic aqueduct or aqueduct of Sylvius. Okay. Fourth ventricles, which is located between the pons, medulla, and cerebellum. Questions number 25. Basal ganglia is the part of options A, forebrain, options B, midbrain, option C, hindbrain, options D, spinal cord. The right answer is options A, that's a forebrain. Okay. Basal ganglia is actually the part of the forebrain. Basal ganglia refer to the group of subcortical nuclei which is responsible primarily for motor control as well as other roles such as motor learning, executive functions, and behavior and emotions. The four basal ganglia which is found in brain are caudate nucleus, which is also known as putamen, globus pallidus in cerebrum, substantia nigra in midbrain, and subthalamic nucleus in diencephalon. Questions number 26. The inferior obliques muscles of eyeball receives nerve supply from options A, optic nerve, options B, trochlear nerves, option C, oculomotor nerves, or options D, abducens nerves. The right answer is options B, that is trochlear nerves. The inferior obliques muscles of eyeball receives nerve supply from trochlear nerves. Okay, let's see the nerve supply of the eye. The eye is mainly supplied by there are three types of nerve. That's sensory nerve supply, and there's a motor nerve supply, and there is a autonomic nerve supply. Okay, sensory nerve supply is actually done by ophthalmic nerves, which is actually the branch of trigeminal nerves, which has further branches. That's lacrimal nerves, which supply lateral part of the eye. Frontal nerves, which supply conjunctiva, middle part of the eyelid, and skin of forehead and scalp. Further divided into supraorbitals and supratrochlear nerves. And there's a nasociliary nerves, which divide into long ciliary nerves, ciliary bodies, iris, cornea, and posterior ethmoids, which supply ethmoids and sphenoids sinus, anterior ethmoids and infratrochlears, terminal branch of the nasociliary, supply conjunctiva, medial part of the eyelid, lacrimal sac, and caruncles. Okay, motor nerve supplies, which mainly includes oculomotor nerves, which has superior divisions, which supply superior rectus and levatus palpebrae, superior, inferior divisions, which medial rectus, inferior rectus, and inferior obliquus. And there's a trochlear, superior obliquus muscles. Okay, and there is a abducens, which supply to the lateral rectus muscles. Okay, if we see that mixed motor and secretory nature, that's the facial nerves which supply to the motor to the face, especially to orbicularis oculi, secretory to the lacrimal glands. Okay, and if we see that's autonomic nerves, there's a two nature of autonomic nerves: parasympathetic and sympathetics. Parasympathetic includes oculomotor nerves, ciliary and sphincters, pupillary muscles, facial nerves, lacrimal glands. Okay, sympathetics, postganglionic fibers from superior cervical ganglionic. Okay. Questions number 27. The motor cranial nerves is options A first, options B fifth, options 6, C seventh, options D 11th. The right answer is options D, that is 11th. Okay. The 11th cranial nerves is motor nerves. We can learn that this cranial nerves, the cranial nerves are the nerves which is directly originated from the brain. Okay, and there are 12 cranial nerves. If you see that, there's a olfactory nerves, optic nerves, oculomotor nerves, trochlear nerves, trigeminal nerves, abducens nerves, facial nerves, vestibulocochlear nerves, glossopharyngeal nerves, vagus nerves, accessory nerves, and hypoglossal nerves. Okay, and if we see that nature of these nerves, then we found there's a sensory, motor, mixed sensory, mixed motor nature. Okay, and there is a note that smallest and thinnest cranial nerves is that trochlear nerves, longest nerve is vagus nerves, and largest nerve is trigeminal nerves. Okay. Questions number 28. The upper eyelid receives nerve supply by options A frontal, options B lacrimal, option C nasociliary, options D infratrochlear. The right answer is options uh, D, that is infratrochlear nerves. Upper eyelid receives nerve supply by infratrochlear nerves. Questions number 29. The phrenic nerves is formed by the union of ventral primary branches of options A, C3, that's the third cervicals, to C5 cervicals nerves, or D, C6 to C8, option C, that's C8 to T2, options D, T1 to T3. The right answer is options A, that is a C3 to C5. The phrenic nerves is formed by the union of ventral primary branches of C3 to C5 nerves. Okay. Questions number 30. Anterior cutaneous nerves of foramen is given by options A ulnar, options B axillary, option C radial, options D median. The right answer is option uh, B, that is auxiliary. Anterior cutaneous nerve supply of foramen is mainly given by auxiliary nerves. Okay, since that forearm is mainly supplied by that brachiocephalicus trunks, while hind arm is mainly supplied by the lumbosacral plexus. Okay, and that the from that brachiocephalic plexus, one of the nerve is auxiliary nerves, and the branch of that's one of the auxiliary nerve, that is the anterior cutaneous nerves, which supply the forearms. Okay, thank you.